Today, we're going to learn about immediate newborn care, one of the most critical aspects of neonatal health. Imagine a baby's first few minutes after birth. It's a delicate transition from the womb to the world. As healthcare professionals, you play a pivotal role in ensuring a smooth start to life. Let's break this down step by step. Definition and importance of immediate newborn care. Immediate newborn care refers to the essential care provided to a newborn in the first minutes and hours after birth. It is designed to ensure a smooth adaptation to life outside the uterus, reduce neonatal mortality, and establish a strong foundation for healthy development. Steps in immediate newborn care. 1. Prepare the environment. First things first, be prepared. The delivery area should be warm, clean, and well-equipped. Check that. The resuscitation equipment is functional. There's adequate lighting. Sterile gloves, suction devices, and thermal blankets are ready. Why? Because newborns lose heat quickly, and their first breaths might need some help. 2. Immediate drying. Instructor, once the baby is born, dry them immediately with a clean, warm towel. This step is vital to prevent heat loss due to evaporation, stimulate breathing through gentle tactile stimulation. Pro tip, avoid vigorous rubbing. Be gentle. 3. Thermal protection. Instructor, remember, babies can't regulate their temperature. Place the newborn on the mother's chest for skin-to-skin contact. This is nature's way of keeping them warm. Cover the baby with a clean, warm blanket and put a cap on their head. If the baby isn't stable, use a radiant warmer to maintain body temperature. Hypothermia can lead to serious complications, so this step is non-negotiable. Airway management. Instructoring the airway is critical, but let's bust a myth. Routine suctioning isn't always necessary. Instead, position the baby's head slightly extended to open the airway. If needed, gently suction the mouth first and then the nose. Watch for spontaneous crying. It's the best sign of effective breathing. At 5, APGAR scoring. Instructor, at 1 and 5 minutes, assess the baby using the APGAR score. Remember, it evaluates appearance, skin color, pulse, heart rate, REMUS, reflex response, activity, muscle tone, or respiration, breathing effort. A score of 7 to 10 is good. Anything below that might need intervention. This score helps you decide the next steps. 6. Initiation of breastfeeding. Within the first hour, help the mother initiate breastfeeding. It's not just about nutrition. It promotes bonding and helps the uterus contract to prevent postpartum bleeding. Educate the mother about proper latch techniques. Breast milk is liquid gold. Since 7, umbilical cord care. Clamp and cut the cord after 1 to 3 minutes. Why the delay? It allows extra blood flow from the placenta, reducing the risk of anemia. Use sterile scissors and ensure the cord stump is clean and dry. Educate the family to avoid applying substances like oil or powder. It increases the risk of infection. Chapter 8, Eye Care and Vitamin Instructor. To prevent infections and bleeding disorders. Apply an antibiotic ointment like erythromycin to prevent eye infections caused by maternal infections like gonorrhea. Administer vitamin K via intramuscular injection in the thigh to prevent bleeding due to clotting factor deficiencies. Identification and bonding. Instruct forget the basics. Attach identification bands to the baby and mother. Encourage skin-to-skin contact and bonding. A calm baby is a happy baby. Special considerations. Not all newborns follow the textbook transition. Here's what to keep in mind. 1. Non-vigorous babies. If the baby isn't crying or breathing well, start neonatal resuscitation following the NRP, Neonatal Resuscitation Program guidelines. 2. Preterm newborns. They need extra thermal protection and specialized care, which we discussed earlier. Recap and key takeaways. Instructor, to wrap it up, here are the key points of immediate newborn care. Dry the baby and maintain warmth. Clear the airway if needed, and check breathing. Use APGAR scoring to guide interventions. Encourage breastfeeding and provide vitamin K and eye prophylaxis. Educate parents about umbilical cord care and bonding. Your actions in these first moments can save lives and set the stage for a healthy life ahead. Now, let's move to case-based scenarios. Are you